Let me introduce myself first. My name is Karen Dunaway. I'm from Honduras. I'm a young activist from Honduras in Central America. And I'm also an ICW member, global member. I have worked in this field since I was 8 years old. Yeah, that's pretty young. But since I have memory, I suffer from stigma and discrimination. And I remember the pain I felt, and I don't want anybody else to feel the same way again. Thankfully, I have an awesome parents that always supported me and always gave me the tools for me to develop a full life. But sadly, there are many young women and young girls out there that doesn't have that education and the privilege that I had. Girls that are being discriminated. And I'm talking right now about Latin America. Latin America, it's a region that needs a lot of help, where sexual education, where condom, where sex, where LGBTQ community, it's a taboo. And that's why I have dedicated 13 years of my life to fight for the rights, for our rights, to reach people's hearts and to educate people to stop stigma and discrimination. That's why today I have the honor to share the panel with these beautiful, empowered women that seek to educate and help all those girls and women who are suffering, girls that are being abused, raped in this very moment. They are crying for help, thinking they are walking alone with no end. There are girls that need our help right now. To start this panel, let me introduce our beautiful panelists that you may already know. First, we have Graça Machel. She is a renowned international advocate for women's and children's rights and has been a social and political activist over many decades. She's a former freedom fighter and was the first education minister of Mozambique. She's a member of the Elder Girls Not Brides Board Chair Partnership for Maternal, Newborn and Child Health, African Ambassador of a Promise Renowned, and many other groups. Thank you so much, Graça Machel, for being here. It's an honor.
Thank you.
Also, we have the pleasure to share this panel with the beautiful Charlize Theron, who gave an incredible speech yesterday at the opening session, right?
Thank you.
You may already know Charlize is the most celebrated actresses of our time. In addition to Charlize acting, a success and principal involvement with her film and TV production company, Charlize serves as a United Nations Messenger of Peace and founder of the Charlize Theron Africa Outreach Project, CTAOP. CTAOP mission is to empower and invest in Africa youth to keep themselves safe from HIV. Through its support and community-engaged African organization, CTAOP is able to provide young people with the tools and skills they need to protect themselves, live healthily, productive lives, become agents of change, and shape their own futures. To date, CTAOP supported programs and tools that have reached over 2 million young people across South Africa. Thank you so much for your work.
Thank you for having me. Thank you.
We have also Ambassador Deborah Burks. The Ambassador at Large, Deborah Burks, is the coordinator of the United States government activists to combat HIV and AIDS and U.S. Special Representative for Global Health Diplomacy. As a U.S. Global AIDS Coordinator, Ambassador Burks oversees the implementation of the U.S. President's Emergency Plan for AIDS Relief, known as PEPFAR, the largest commitment by any nation to combat a single disease in history, as well as the U.S. government engagement with the Global Fund to fight AIDS, tuberculosis, and malaria.
Thank you.
Thank you. It's an honor for us to be sharing this with us.
Thank you.
And lastly, we have the Elizabeth Taylor winner, Martha Tolana. She is a Zimbabwean feminist, openly living with HIV. Martha participates in national, regional, and international advocacy around the rights of women living with HIV. Martha helped establish and headed both the health program at Gays and Lesbian of Zimbabwe and Network of Zimbabwean Positive Women. She is currently working in Zimbabwe with children and women infected and affected by HIV. Thank you so much for being here today. And let's start this panel discussion. I will tell you how this special session will be. It's not like a debate nor a regular panel. There will be questions in this great big TV that some of our young women ask questions, and I will ask one of you personally to answer those questions. If some one of you want to add something, you are free to do so. Well, let's see the first question.
Helping women to fight stigma in their own communities and not kind of feel alone in doing so. So generally, how do you think we should get a sense of wider community?
I will say the question for you. What do you think the world could do better on helping women to fight the stigma in their own communities and not feel alone in doing so? So, generally, how do you think we should get a sense of wider community? I think that Charlie Cerrone will be great for this question. Can you please answer it?
That's incredibly sweet. There are an entire panel that could probably answer this a lot better than I can. But I think just from my small amount of experience, I'll say that we need to support and strengthen systems within communities that are community-based, that are run by community leaders, that are paying attention and underlying the issues when it comes to young girls in particular. I think that any kind of intervention really has to be very specific to who you're trying to help, who you're trying to support. And I think that we have to start focusing a little bit more on how to reach women, young girls. I think we have a very clear understanding that they are the ones that are falling through the cracks, and they are also have the most prevalency to become HIV positive. So I think that we have to leave a conference like this, and we have to figure out more effective ways, innovative ways to support those grassroots organizations and to encourage women to start supporting women. I think that would be a good place to start too. I think a lot of these young girls are creating communities for themselves, and it's really powerful to see how they can empower each other. I would not want to be the only person to answer that question. I would like to have Martha, or I don't want to put anybody on the spot, but...
Yeah, thank you. In addressing stigma in the communities, I think it's important to get to the young women themselves, to see the communities that the young women live are so different, and their realities are so different depending on their economic status, depending on their social status, on the type of place where they live. And they would know best in terms of how do they work within that community, who do they want to work with. I think if we continue to try to make up strategies from afar and take them to the young women where they are, they may not work, but actually have solutions coming from the young women themselves within their communities, and maybe help to facilitate a way for the young women to be able to have dialogue within their communities, to have, I'm sure in their communities they would know who are the key the key points, the word key now is becoming very, I think it's becoming, but in a way that they know whom they would want to facilitate a dialogue within their community that will ensure that that stigma is addressed, that stigma is defeated. I think that's where
Can I
Sure.
come on here maybe? I'd like to submit that one of our problems is that we focus on young women, girls, young women, and women. But particularly, I think we need to address the adults who are around them, whether they are parents, whether they are teachers, whether they are health professionals, religious leaders, traditional leaders. Because we, the adults, are the ones who are carrying a lot of preconceptions, a lot of our, stereotypes, our fears, our insecurities, and then we throw them into these young lives because we do not know how to deal with our own insecurities. And I think it's important for us to accept that we should not assume that we know enough. I don't think we do. We know something, but I don't think we know enough. And because of that, there is a need for us to deconstruct, if I can call it, deconstruct the kind of preconceptions which are around these adults, around these children. If that doesn't happen, they will struggle, they will organize themselves in peer groups, but the supportive systems around, the caring systems, the understanding actually of how a child has to grow up in an environment where she or he grows with no fear, is confident enough, and even to be able to interact with different generations in a healthy relationship. So what I'm trying to say is that this stigma we're talking about, it's not about the young ones, it's about us, the adults, who have not come to the point where we have deconstructed our own way of seeing things and doing things. And because of that, we are unable then to embrace, to care, to guide, and even to allow these young lives just to blossom the best they can. So I just wanted to add this dimension as well.
No, that was very important. We have to change first the institutions to change adults' mentality for us to teach us because they have more experience. And also, do you want to add something or?
I just really quickly, I think, as you said, we don't know everything and we don't have one solution. I think we do know, though, what the issue is now. And it took us longer to get there than any of us are comfortable with. But I think there are different needs by different age groups. And I think part of what we're trying to do with Dreams is finding to do many different things, work with the parents, work with the community, work with the schools, knowing that women's lives are not static and in one place, and making sure that we're addressing all of the different places and at the same time really dealing with the tough issues that put us in this place, which we know when young girls' first sexual experience is rape, and that's anywhere between a quarter to a half of the young women's experience. We have to talk about it and bring that in the light of day, just like we had to do at the beginning of the epidemic with HIV, so that we're really addressing the issues and not putting it all on the young woman to address it for herself.
Sure, we have to change the environment first for us to grow in a really good place. No, nobody want to say some more? No? Should we pass to the second question? Okay. Can you please put the second video?
Question should be coming somewhere there.
How can we address the current high rates of sexual violence against women, not only in the Caribbean and in the Americas, but all over the world?
Basically, we're talking about sexual violence, and I think the perfect it will be, Gracia Michelle, if you want to answer this question.
This is a tough one because gender violence is a global scourge. It doesn't recognize really whether it's a developed country or developing countries. I think it comes to the core issue of how human beings relate to each other. In this case, how men and women, whether they are young or adults, how they relate to each other, how they value each other. I think it is an expression of the type of socialization in which many grow believing that they have more power than women, and they can use this power against women whenever they feel challenged in the space where they feel comfortable. Because at the end of the day, the violence is expression of insecurity from this person, and not only insecurity, but it's also feeling that his space is no longer the one he can dominate, and he will discharge those things against women. So I think it has to do with the socialization, and I would submit here that we have a big challenge of really questioning seriously masculinity, what it means to be a masculine human being, and how, despite the fact that physically you are different from the one who is feminine, but you relate and value and respect the dignity of each other without feeling that you are challenged and that you are superior. So it's a big issue. It's not an easy one to deal with as far as I'm concerned. But it has also the other side, is that we need to question the methods and the methods and the strategies which we are supporting, particularly girls and adolescents and young women, to grow while they are self-confident and they have the tools and skills to assert themselves and to be able to establish the distance which, even if someone is trying to abuse you, but you put yourself in a situation where you say, not beyond this distance. It is going to be taking a long time, but it's the two sides of the issue in terms of violence. It's the one who is a protector, and it's the one who is being, violated. So this one, who is the masculine, has to come down and recognize his humanity to say, I'm more humane when I relate in a dignified and respectful with others. But this one has to grow to a point that I'm no less than anyone, and no one has rights over my body, over my space, over my rights, and who I am. So it's a balance which has to be brought along as we work with the issue of violence. But again, we go back to what we said here. This is a general assertion. But the societies are not equal. What is behind the traditions and the social norms which fuel attitudes? That's what I was trying to say, Ambassador, that we do know the general space. But the way you have to deal with violence when you are in a certain socio-cultural environment, it's not going to be exactly the same in other part of the world. So when I say we do not know enough, we know the general thing. But in every setting where you are to be participating, I think we need to take time to ask questions, to listen, to understand, and slowly, while we are bringing new messages, but we deconstruct what is behind the behavior of people. Otherwise, social transformation is not going to happen if it is messages and attitudes which are coming from the top without empowering the real people who have to change their status, and they are going to be able then to run their lives in a more, what is the word? Assertive way. Yeah. So I'm just submitting that now we know the general things, but we need to be much more specific and go much more deep in terms of understanding the social dynamics which are behind certain certain attitudes and behaviors. And that requires, in my view, a lot of humility from our side.
Thank you so much. You're certainly right. Thank you. Deborah Burks, what do you think about it?
Well, I'm encouraged by the discussion of, change, but I think at the same time, we have to be very clear and be immediately clear that sexual violence against women is unacceptable. And the community needs to stand up, along with the police and the political leadership and the tribal leadership, and say, while men are evolving, there are consequences to behavior that is unacceptable in our community.
Yeah.
And so there has to be clear consequences. And I think when you have something that's so prevalent, when the shared experience, not only of the mothers and the aunties and the girl child, is that rape is almost inevitable, that's when you have to break that chain while we're working on social dynamics for having a place and a safe place where young girls are believed, where women are believed, and there's prosecution for sexual violence and rape.
Wow, that's right.
So good.
You want to add something?
Yeah, I would just echo that. I think that, it's really important that we put pressure on governments to have legal and executive frameworks in place. And I think that there should be no allowance for anybody to get away with anything like that. And I think that's the biggest problem that we have, because I think a lot of that ties into the fact that there's a lot of action out there that shames a lot of these victims into silence. And we've been struggling with that for a very, very long time. And I have a personal belief that I think a lot of that is interconnected with how women in our society have been made to feel about sex in general. And then when you add violence on top of that, we have no space to speak about these things. We are not allowed in our society to speak about these things. We either become victims, which I think most women don't want to become, or we are thought of as the problem in a lot of places in the world. I agree with my colleagues on this stage. I think that there are some things where you can see padding and room to move on this subject. I feel like we have to be a lot harder and stronger with what we allow and what is acceptable. And I think it's very, very clear on this subject that none of this should be happening to young girls.
That's right, certainly right. You want to add something too?
Yeah, from my side, I think I do agree with what my colleagues have said, and also saying, to me, from where I stand and what I believe in, this is a system that is structured within patriarchy. And just saying, from someone who likes to toy on the street, I would just say patriarchy must fall. But then how do we define it to make it not just a hashtag on social media, and also not just a chant that we are saying while we toy on the street, but to actually say what is the meaning for me as a woman. When I say patriarchy must fall, I want safety. I want to be safe. I want my daughter to be safe. I want my granddaughter to be safe. And not just my daughters, the children I'm bringing up. Because now, a lot of times, I see that we are now also blaming ourselves as women when we say, as women, we need to teach our sons That is correct. But we do not just teach our sons on our own. There needs to be a commitment because we don't raise our sons on our own. There's a whole community that raises sons, and this is where I would say patriarchy must fall. I'll leave it there for now.
Thank you so much. Thank you. Yeah. This is a really hard topic for some women to talk about because sexual violence is still a taboo in some other countries because they victimize a woman that have been raped and other women that doesn't want to acknowledge that they have been raped. So they don't go to the police for a stigma and discrimination, especially what the people will think about them.
Also, I'll just say, I was really shocked by this. A couple of years back, I had spent some time with the Rape Crisis Center here in South Africa, and I was shocked to find out how many people, women, did not know what rape was. They had been raped and not known that they were raped. They just thought that's what sex was. I think that's something that, we have to look at. Are we becoming a culture that can't put a line in the middle of like what violence is and what is a healthy sexual relationship? I was shocked to hear that. I wasn't made aware of that. I didn't know anything about that. And the idea to me is, I went home that night and I thought about the idea of living in a world where you don't know your rights. You don't know when you've been violated, and how unbelievably frightening that must be to not be in a space where you understand, what your rights are, what you're okay with and what you're not okay with. And I think, I do believe it's up to us to really be very clear with that message that we send out into our schools, into our churches, out on the street, into our communities. I think it's a combination of what everybody has said here. The adults have to take that responsibility, and I think young girls and young boys have to kind of help and support their peers to stay on that track.
Yeah, I think that the most important thing is sexual education in schools especially. Sadly, I graduated from high school and didn't have any sexual education class. And many of my classmates didn't even know how to use a condom or how to open a condom.
I didn't have sex ed when I grew up. I didn't have anything like that in school. I was just incredibly lucky to have a mother that loved encyclopedias and could pull out a lot of pictures of graphic penises and vaginas, and loved biology and loved talking about the biology of the human body. I was incredibly blessed. I had one parent who taught me enough so that when I went out and had my first sexual experience, I knew enough to protect myself. And this always gets me very emotional because I think we take for granted how many people have access to that, have access to cohesive, responsible, reproductive, sexual education. I think we just kind of think this, everybody has a computer and they can Google something, or they have a parent that's going to teach them something, or don't worry, they'll get it in school. But those things are not as accessible as we think. I think we really take those simple, fundamental things for granted, and we just kind of assume that the rest of the world has it, so if they're getting HIV, becoming HIV positive, it's their fault, they're being irresponsible. Most of us don't know the facts about how to protect ourselves, or how to have a healthy sexual relationship, or to have a healthy platonic relationship. I think we have to kind of go back to square one and find that compassion to understand that we have to work from a space that is not necessarily the space that we're used to.
Yes, we have to let know that women have the right for their body and that they make the decision of their body too. Well, let's pass to the third question, sorry. Can you please play the video for the question?
Why is it that women are always being questioned about their virginity? Like, are you a virgin? That is the question they are always being asked for marriage. And why not men?
A question that the people ask me too.
Such a good question.
Yes.
Such a good question.
Yeah, Martha, can you please provide us with the question?
Yeah, to me, this is about control of women's bodies. And which is not acceptable, and which makes me continue to hashtag patriarchy must fall, and toy chanting patriarchy must fall, because really, really, I'm asked about my virginity and go to report a rape at the police station. They will ask whether you're a virgin, what were you wearing, and things like that, and that degrade you more and make you more of a victim. You are not believed. You are presumed to be guilty of something you've done, yet you are the one who's reported being violated. And it's worrying that as you report, you are already getting violated by the things that are said to you when you are seeking protection. And I think this is something that we should not accept, and this is something that we should learn as communities to be able to support young girls, our daughters, our nieces, our friends, other women, even older women are getting violated. Depend on where they are placed. So there are some people who are my age who are not even able to go to they get violated, they are still not able to tell anyone. So they are not able to get the support because of past experiences or the experience that a colleague has had or a neighbor has had. So these things should not be acceptable, and we should be in those communities that nurture a culture of saying that I'm here for you, I'm my sister's keeper, and I'm able to, to protect you and to look out for you. And I think this is the only way we will not have this control of women's bodies. We should just say no to this control of, and it should start with me as well, because sometimes it's a woman like me who will see her and start asking, so I need to check, have you not been, you should not be sleeping with men, because I'm seeing my daughter. When I see my daughter and she's going, what am I really saying about her? And I'll refer to what Charlize has said about developing a healthy a healthy perspective to the sexual being that I am and sexual behavior and what you should do, the choices that you make that are healthy and supported, so that you keep safe. We look out for each other's safety. Thank you.
Thank you so much. Charlotte, you said it was a terrific question.
This irks me so much because it hits me on such a personal level. I have personally been in that position, and I don't think there's a woman alive who has not been in that position. And it's such a double standard in our world, where we have such a clear cut of what it means for a man to have a sexual active life and what it means for a woman to have and they are so completely different. One is completely based on shaming and devaluing the female because of any kind of sexual experience. And for men, it becomes, it becomes like, it's like part of their manhood that's celebrated, it's accepted, and nobody even asks. It doesn't exist. It upsets me a lot because I think that it goes back to women not feeling like they live in a world where they can be valued for being equal. We have sexual experiences just like men, and for some reason, to make that say something about us, it's the Madonna whore complex. We see it all across. We see it in art, we see it in culture, we see it in cinema. The idea that a woman lives a complex, layered, conflicted life, goes out, experiences, has sexual experiences, makes some mistakes, don't we all? Yes. Those women are not really represented in our world properly. We are still stuck in a society who wants to see women either be really, really good mothers who don't have sex, or prostitutes. That's the range for a woman in this world. Anything in between, we get very uncomfortable. It's like, no. A guy can explore that a little bit more. No, we feel more comfortable seeing a guy kind of making mistakes or taking a woman home and having a one-night stand and maybe not regretting it the next day or whatever it is. But as soon as a woman does that, we as a society start feeling very, very uncomfortable. And I think it is our responsibility, I have made it my responsibility, that in my work, I will never, ever play a character that represents a woman in that light that is so just black and white. I made it my responsibility to find a way to show what I think women are. And you know, I say this, I think, because I've been part of this. You know, I've personally felt part of this struggle for myself as not just a young woman, even, you know, in my late 30s I struggled with this, you know, because in my late 30s I was single and I was like dating all of a sudden, and you know, in my late 30s I've had a life, you know, and I would date these guys and they'd be like, oh my God. I'm like, what? Like, I know for a fact that you have slept with way more people than I have. You know, yeah, exactly, and it's not an issue. So I've experienced this very recently in my life, in my late 30s. So I do think it's our responsibility. You know, I make it a real point to, I know that my daughter will know that her value is placed in what she wants it to be placed and not what men tell her her value is placed in. It's time for us to take ownership of where we want to place our value, and it's enough. Nobody gets to tell us where that is anymore.
I think the real problem with what you just described for us in living in this is it then comes into the public health sector. Mm-hmm. It becomes acceptable for public health physicians and nurses in public facilities to bring that same prejudice into the clinic when they're meeting with young women. And that's when we're expecting young women, and we say to who don't, come, you know, you're welcome, we'll talk to you. They only want to distribute their message, not the public health message that's relevant to that young woman. And I think when these community pieces take over our public health messages, that's when there has to be consequences to that, whereas public health physicians and nurses cannot move themselves into treating all as equal without stigma and discrimination. They don't belong in the public health world that are interacting with our young people.
Thank you so much.
Sure, Tom. Perhaps I can come again here. When I was saying, for instance, the issue of how parents, you know, there are communities which they make it a point that before a young lady is to get married, that they have to do a virginity test. They do. And that's what I was trying to say at the beginning, that these communities in which mothers and aunties and mother-in-laws to be, they believe it's acceptable to do this.
That's what happened to them.
Yeah, and then they continue to impose this on young generations. So I think really the point I was trying to make, and I'll insist making, is you can have at the public level certain kind of messages, and you need to have them, you need institutions to act, etc., etc. But issues will continue to repeat themselves because the source is not being addressed. I was not saying that we should only, that we shouldn't focus on the public institutions. We shouldn't punish. This is not what I was trying to say. Is that if the source of the cause of the issues is not being addressed, 20, 50 years from now, we'll continue to be at the same level. But
I have a question about that.
Yeah.
What do we do when we feel, and I don't know how to really even articulate this, but because I'm really interested, I want to just hear your perspective on this. What do we do when we realize that the parents are so stuck in their tradition of believing what they believe is right, that they're never going to break that tradition? What do we do then? Do we
that's where the public sphere come, and I wanted to deal with this. Are we training the health professionals, the teachers, and even, I don't know what I can call it training, but to address the religious leaders on these issues? Because that's in the public space. The parents may believe that this is right. But the second place where a child is and spends most of time and somehow gets a little bit of a lot of new values is at school. So the question we should ask, are we training our teachers to be able to deal in an open and positive way with how to educate children? I'm not saying sex, I'm saying sexuality, which is a different thing.
Yeah.
Are we doing this? Because I don't think our schools are providing that kind of caring and support to children. What the ambassador was saying about health professionals, it's exactly that. I mean, a child goes to even to the so-called youth-friendly centers for advice. And then someone will say, what are you doing here? You are too young to come here. Or sometimes it's, oh, my child. Of course, the child ran away from the mother because mother could not advise and goes to the youth-friendly center, find another mother. So how does she communicate with someone who can give just information, guidance for her to know how to deal with her issues? So what I'm trying to say is that these two spheres of life have to come together. Because if they are not, then we will continue to have this. Let me give another example. In this country, how many cases are really taken to court and they are tried fairly? Why? Because either prosecutors or judges or the police even sometimes, they are not able to understand what you are saying, Shalene, to say, this is unacceptable. So instead of dealing with this case on the basis of the rights of the adolescents, the rights of this young woman, the right of the women, instead of doing this, the baggage which they have in their mind, it continues to punish the person who is seeking through institutions, who is seeking justice. We have seen it again and again. So I'm trying to say that all of us here, because we care about these things, we need to go beyond what we know and try to say, how do we improve and sharpen the way society itself has to change itself while we are doing this, which is legal, it's acceptable, it's unacceptable, etc., etc. But without social change in those things, I continue to feel it's very difficult. Instead, I would like to also some of you, like me, have grown in rural areas. It's really very hard. In those rural areas, it's very hard. It's simply because neither your parents, neither any community leaders, has the openness, to give guidance to girls. What do you do? Even when there is a case which, this child was violated, they ask you to go and negotiate. I don't know whether you know of this. They ask you to negotiate. They even ask you to pay a price to say, okay, you violated this child. If you give a cow, then the issue is settled between the two families. How do we move this? And because in numbers, we have more or less maybe 40% of our people live in urban areas. But in Africa, we still have maybe more than 50% of people who are living in rural areas, and where these issues are much more entrenched than probably in urban areas. So that's why I'm trying to see, we need to do both. We need to do both. It's very complicated.
It's like, it makes me think of, how in the 60s, women would smoke, didn't know, when they were pregnant, they would smoke, and nobody knew the damages, the consequences of smoking when we were pregnant. There were great black and white shots of Jackie Kennedy, smoking 9 months pregnant, right? And they did it because their parents did it, and nobody knew. And when you think about that campaign and where we are with that today, and the knowledge that most mothers have about, the consequences of smoking. If you think of, where the investment went and where the focus went. It's a good example to show you that it can be done.
And it didn't take that long.
It didn't take that long.
And we didn't make it too complicated.
And we didn't make it too complicated, but mothers got that information and they changed that behavior, even though it was something that came with their families and with their generations, and they just did what their parents did. And I think it's a good example for us to see that there's real potential when we put real focus and real funding behind something with real care and need and want to change.
And the communities, the churches, the elder leaders all speak with one voice of certain things being unacceptable. That brings change. But if we try to do it all piecemeal, we're not, I mean, we just have to talk about this in the same way we talked about bringing treatment to all, and how much we're getting closer now than we were in 2000. But we have to have that same march in the street, go to the churches, go to the schools, and go to the political leaders in the countries to really say this is unacceptable, and that message goes every place.
I was just making the...
No, you did it
Yeah.
great.
Yes.
You did
No,
it
no,
great. You did a
I
great job.
agree completely.
Yeah.
I agree.
We have to
You can say something.
change women to think about the value of a cow like we did the importance of a cigarette. All right, who's going with that? Who's running with that one?
Thank you so much. We're running out of time, so I have to go to the next question. That's about prevention. Can you please... yeah.
Hola, mi nombre es Cindy, soy de Puerto Rico y mi pregunta es, ¿qué otras estrategias innovadoras, además del uso del condón y del PrEP, existen para evitar y prevenir la infección de VIH?
I will say it in English if you didn't catch it. Hello, my name is Cindy, and I am from Puerto Rico. I would like to know what other strategies, aside from using condom and PrEP, exist to prevent HIV infections. Ambassador, please.
So what other strategies besides PrEP
And condoms.
so besides PrEP and condoms?
Yes.
Well, I think as a community, we're all working towards an HIV vaccine, and we're working towards a cure. So we hopefully will get strategies that exist for that. But I think this is where we come back to this comprehensive piece. We're not even using all the tools we have now. We're not using all the educational tools. We're not using all the community tools. We're not engaging in all of the layers of women's lives to make sure that when they need something, we're meeting that need. And I think it's been really a privilege to work on Dreams, because through Dreams we've been able to really not only see young people and to see their risk, but also hear young people and understand their risk. And those two things are a little bit different. And that's allowed us to really see that between 10 and 12 we need to do one thing, 12 and 15 we need to do another thing, 15 to 18 another. But we also have to make sure that we meet them where their concerns are. And when I talk to young women, their concerns are access to reproductive health commodities so that they can live the life that they want to live. And that gives us an opportunity then to talk about the options of PrEP and condoms and all of the other options that we have to protect them from getting HIV. But part of this is meeting people where they are in that moment and ensuring that we are giving voice to what their concerns are and listening and addressing those first, and then move on to discussing risk factors and options like PrEP and condoms.
Thank you. Martha, you want to add something?
I just want to say that the question to me says to us that so far we've been failing.
We don't have enough.
We've been failing women. We do not have enough, and we need to do much. We need to do much more. We need to. I know there is post-exposure prophylaxis, but it's something as well that women get asked about if they ask about it in the pharmacy or at the clinic, and it's something that is not really accessible to women. So, in a way, to me, I'll just acknowledge and say it's a difficult question to answer, to say what else do we have. We failed, and I'm part of that failure, and just to apologize to the women to say we failed you, but let's work together to get, more tools in the box.
Thank you so much, Marta. Sadly, we can't move on with the other two questions because we're running out of time. And I really want to give this opportunity to those young women that are with us today to ask their questions, their opinions. There's a microphone in the alley for you. I want that young women to talk, especially young women that need to express themselves. Yes, you can ask the question. Yes.
Hi, I'm Tirza. I'm a doctor. I'm working with an NGO called Orange Babies. We focus mainly on PMTCT. And I just wanted to add on to what was said earlier by the panel on how to reduce stigma and how to reduce violence. One of the things that we have seen is we started involving the go-go's or the grandmothers and the grandfathers in the communities. And we started educating them with knowledge about sexual education. And we've seen that they've had a very big impact in the community because they're very influential. They have a big role in the communities, especially in the education of the grandchildren. And we've seen that they had a big impact in educating these grandchildren on their sexual education. So just something to add on to what I said, how can we reduce stigma? How can we reduce violence? I think by educating the young boys, by the grandfathers, educating the young girls, by the grandmothers, they can have a big impact on reducing stigma, reducing violence.
Thank you. Before you answer that, I like to start with 3 questions first, and then answer the 3 questions at the same time, for us not to waste any time.
Was just a comment.
That was great. Thank you.
Thank you. The lady back there, please. Yes.
Hello. My name is Michael. I'm from Poland. I work for International Federation of Medical Students Associations, IFMSA. And first, I would like to thank for amazing panel that is going on. I just want to share that we as IFMSA are working to raise awareness for medical students who are going to be their providers in the end, and we are going to be the ones who will end AIDS by 2030. And I believe that ending stigma and discrimination should also start in healthcare. And my question to the panel is, because we have 1.3 million medical students ready to work and ready to work with young people living with HIV, young key populations. And my question is, like, if you see any of the interventions that should be done by medical students or young healthcare providers to fulfill the 2030 agenda. Thank you.
Thank you for your question. You would like us to answer this question quickly?
Do you want to do the other 2 right here at the front?
Oh, I'm sorry, I didn't see you.
Hi.
Yeah.
Thank you for such an amazing panel. My name's Talia, and I'm an HIV cure scientist in Australia, where our cure trials are predominantly in male participants. I feel we're often disengaged as scientists, which is unfortunate. How do we close the gap between cure research happening all the way in Australia to guarantee that the cure drugs we're trialing are safe in young women of reproductive age, particularly given the types of drugs we are currently using? If we don't start thinking about this now, we run the risk that young women may not be eligible to receive cure drugs should they become available. And what a girl wants, I think she wants access to a cure.
Yes.
Hi, I am Laura Angelis. I have a quick comment and a question. If someone have asked me what a girl wants, I will say meaningful participation, not only bring to spaces to give a speech and talk about my life, because people usually say young women should raise their voices, but some young women have been raising their voices for a very long time, and now it's time to put those voices in action to get results. Also, I will say positive sexuality. I want to be able to enjoy my sexuality regardless of my HIV status. And number 3, economical empowerment, definitely. So my question is a very personal question. If you don't feel comfortable answering, that's totally okay. But have you ever get tested for HIV? And if you have, how was that experience?
No. No, I think we have our 3 questions. So maybe if you... What's the question? If you have do the HIV test. That was, I think.
Yes, I have. I did it in a clinic, a mobile clinic. I've been tested several times. It's always a little nerve-wracking, but I think we have to know our status. I think it's a responsibility that we have to ourselves and to our fellow people that we live with. I think it's just part of what we have to take on as ownership for ourselves. So, and I'm negative.
I also did. I also did tests, and in many ways it was also a way of contributing to other people to know that, for you to be positive or negative, it has nothing to do with age. I was very much older at that time, and we sometimes think that because you are in your 50s, you are immune. It was important to say, no matter in which stage in life you are, you need to know your status, and you take a test. So the question was, how did you feel about it? One, it was this kind of empowering yourself to say, I do it. But at the same time, it was that message which you are trying to send out there to encourage other people to do it.
Thank you.
Just really quickly to the CURE researcher and for the others asking about medical students and hopefully nursing students. I think part of this normative and social change needs to be driven by them asking those questions of their mentors when they feel like they have stepped over the line and not providing the information that a client needs or are providing it in a stigmatizing or discriminatory way. They're going to actually have to speak up for that. And same way with a CURE researcher, you should be asking that very question, and who's providing your funds? And saying, why aren't we enrolling 18-year-olds, 17-year-olds, 16-year-olds now so that we'll have that biomedical data about the impact of hormones and metabolism and all those issues that we have.
Thank you so much. Unfortunately, we just ran out of time, and I'm sorry for the ones who are speaking. Yes, they told me it's time. I'm sorry. I know this was an amazing panel, and I hope that it was a great panel and help you just like it helped me. And I think that the 2 main points in this panel was to change institutions' mind for girls to grow up in a healthy environment, and the main point is to let girls know that they have the right for their bodies, that they have the right to make their decisions, and not let anyone else do them for they. And I'm sorry, and I'm done. And my last conclusion is that please work with young people, with young women. We are the generation that will end AIDS. I've been working in this field 13 years, and I am seeing progress right now. 13 years where in Honduras there was nothing HIV information, and now there are so many people that love HIV positive. There are people who really support us. Thank you for being here until the end, and hope you had a great time. Enjoy the rest of your day. Thank you.